A large part of my practice is representing internal medicine specialists or family practice doctors, and I've noticed for them a big increase in the 25, 30 years that I've been in practice from rarely being sued to now they're about the middle of the pack in terms of specialties and being sued. The types of things that they get sued for are disease management or failure to diagnose. And I think that those come about largely because of the number of chronic medical conditions that are increasing now. People with diabetes, high blood pressure, obesity. It's important to communicate with the patients and make sure that you do manage them and get them committed to being responsible for their own long-term care so that they live a healthier life and hopefully avoid the complication that could then turn into a lawsuit.
One of the trends that I've seen develop in my practice, especially with primary care doctors, is patients who are told sometimes visit after visit that they need to lose weight, that they need to eat better, sometimes even still today that they need to stop smoking, and that it's important that they do so. And usually that's what's documented in the physician's chart, is that the patient was told encourage lifestyle modifications, things like that. What's not documented in the chart is what can happen if the patient doesn't do those things, such as stroke, heart attack. And what happens in these cases that I've seen is that does happen to the patient. The patient has a stroke or a heart attack or a serious medical incident and then claims that the doctor never told him or her how serious it would be to their health if they didn't make these lifestyle modifications. I encourage my physician clients to document the seriousness of those risks in the patient's chart and that the patient understood it. And if at all possible, have the patient even sign something that says that they understood those risks and that they acknowledge that they could cause serious harm to their health.
Probably the most important trend in the long term is the influence of technology on the practice of medicine and on how medicine and law interact. In the first instance, patients are coming into physicians' offices with much more information based on their own internet searches. They're asking very good questions and they're demanding good answers from their physicians. And fortunately, on the other side, the physicians have access at their fingertips to that same technology. In terms of trial technology, in terms of when a physician is sued, there has been a seismic shift in the last 10 years about how it is that lawyers are defending their doctor clients in courts of law. The old days where talking heads would stand up and lawyers would speak to the jury and try to convince them through verbiage, those days are rapidly disappearing. And in their place, what we're seeing is increased and sophisticated technology in order to better present the doctor's case to a jury. And conversely, we're seeing that from plaintiffs' attorneys on the other side.